University Faisalabad. I was discussing about the protein. For amino acid, for example, adrenaline, noradrenaline, and these are amino acid. Adrenaline and noradrenaline, their level if increases in it causes hypertension. Thyroxine is important for the growth and other functions in the body, and it is released from thyroid gland. Physiological active peptide is glutathione. It is present in the cell membrane of RBC. It means that is produced by PA2 that is obtained from uh, those monophosphate shunt or pentose phosphate shunt. Some of the vitamins are proteins. Niacin is from tryptophan. Tryptophan is an amino acid. Serotonin is also derivative of amino acid. And the serotonin level decreases in the body. It causes depression. Its normal level is better. If its level is slightly elevated, then mood is also elevated. When highly increases, it causes madness and there is problem. And it may cause psychosis and psychiatric problem. Melanin also found from the protein or amino acids. Intracellular concentration of amino acid is much higher than of extracellular fluid. The active transport system that requires ATP maintains the concentration gradient for the movement of amino acid from the ECF into the cells. At least seven different transport systems are known for the transport of amino acid from ECF into the cells. The most active system is gamma glutamyl cycle. Plasma amino acids. Nitrogen enters the body in the form of amino acid contained in dietary proteins. Nitrogen leaves the body as urea, ammonia, and other products of amino acid metabolism. Only 75% of the amino acid derived from the hydrolysis of body protein are used for the biosynthesis of new tissue proteins. Remainder serves as precursor for the compounds such as porphyrin, creatine, neurotransmitters, purine, pyrimidine, and other nitrogenous compounds. Amino acid pool. The amino acid pool consists of amino acids released by hydrolysis of protein plus free amino acids distributed throughout the body. Formation of plasma protein. These include enzymes, antibodies, hemoglobin, milk protein in lactating mammary glands, pro- proteinous hormones such as insulin and glucagon. Formation of nitrogenous compounds other than proteins. These include thyroid hormones, catecholamines, adrenaline and noradrenaline, choline, creatine, purine, pyrimidine. These are formed from amino acids or proteins. Ammonia and keto acids. Ammonia is formed by deamination of amino acids. If the level of ammonia increases, this condition is called hyperammonemia. If ammonia is increased, it causes toxicity, and toxicity may be vomiting, irritability, mental retardations, and coma. If the patient is not treated, there may be a death of the patient. Ammonia is a byproduct of the amino acids. Amino acids are obtained from the proteins. Ammonia is increased in the body, it means there is problem in the kidney. If urea level is increased, then problem may be in the uh, kidney. If there is problem in the kidney, then you can check urea and creatine. And creatinine and urea tells about the conditions of the kidney. You can check GFR me for the functions of the kidney. If there is problem in the liver, then you can check SGPT level that increases in hepatitis and other conditions. If there is worse condition, then ammonia level increases and there will be problem. Protein turnover. It means a total amount of the protein in the body is constant. Because of the protein turnover, the rate of protein synthesis is equal to the rate of protein degradation. It means intake and excretion of the protein is equal. This is called protein turnover. Clinical importance of amino acids. About 1 gram of amino acid is excreted in urine per day. Amino acid in urine are found in free form, peptide and conjugated form. For example, lipoic acid. Renal tubules absorbs more of the amino acid filtered by glomeruli. Amino acid level in urine increases with the increase in plasma amino acid levels. This happens in diabetes mellitus, acute infections, liver disease, and pregnancy. Physiology conditions associated with the loss of amino acid in urine are called amino acids. Biochemical reactions. There may be transaminations, deamination, transmethylation, transpeptidations, deamination, decarboxylation, interconversions of amino acids. There are various functions of amino acid in the body, and this is the structural part of the body, and we need the amino acids or proteins in some and now we will discuss about the serotonin. Serotonin is called 5 and is synthesized tryptophan. Tryptophan is an amino acid. It is also called or actually neurotransmitter. Larger amount is found in gastric mucosa and smaller amount is found in platelets and CNS. It has multiple physiological functions including pain perceptions, normal and abnormal behavior, affective disorders, regulation of food intake, sleep, temperature and blood pressure, and neuroendocrine functions. It participates in the regulations of hormonal secretions of pituitary gland. It stimulates the release of adrenocortical hormones, growth hormones, and prolactin, and inhibits the secretion of luteinizing hormone, follicle stimulating hormone, and thyroid stimulating hormone. Serotonin appears to be involved in the migraine headache. The actual cause of migraine headache is still unknown. Serotonin is an arterial constrictor and it may cause decreased cerebral blood flow during an attack of migraine headache. Serotonin also increases the sensitivity of pain receptors. Catecholamines. Catecholamines include dopamine, epinephrine, and norepinephrine. Synthesis and functions. Catecholamines comes from tyrosine. All of the catecholamines act as neurotransmitter in the brain and autonomous nervous system, whereas epinephrine and norepinephrine also act as hormones. Epinephrine and norepinephrine are released from adrenal medulla in response to fight, flight, exercise, cold, low blood glucose, and low blood pressure. Norepinephrine and epinephrine regulate carbohydrate and lipid metabolism. They increase the degradation of triacylglycerol and glycogen as well as they increase carbohydrate output and blood pressure. These effects are part of coordinated response to prepare the individual for emergency and are often called fight or flight reactions. Degradations. Catecholamines are degraded by oxidation deamination catalyzed by monoamine oxidase and by O-methyl carried by O-methylation carried by catechol O-methyl transferase. The end product of these reactions are excreted in the urine as VMA, metanephrines, and normetaphrines. Monoamine oxidase. It is an enzyme found in neural and other tissues such as the intestine and liver. In neurons, MAO functions as a safety valve against neurotransmitters which includes norepinephrine and serotonin. MOA oxidates deamynate and inactivates excess of these neurotransmitters. MAO inhibitors. These drugs cause inhibition of MAO resulting in activation and prolonged activation action of norepinephrine and serotonin receptors and may be responsible for antidepressant effects of these drugs. Clinical notes: pheochromocytoma. It is a rare catecholamine secreting tumor of adrenal medulla. It may result in life threatening hypertension. It is clinically associated with three syndrome which are uh, von Hippel Linde syndrome, multiple endocrine neoplasia 2, and neurofibromatosis 1. Sign and symptoms of classic pheochromocytoma: pulsating headache, palpitations, diaphoresis, anxiety, sense of doom, severe hypertension, paroxysmal. Diagnosis: for high risk patients, plasma metanephrine testing. For low risk patients, 24 hours urinary collections for catecholamines, VMA, and metanephrines. Abdominal imaging, for example, CT scan or MRI. Management: surgical resection of the tumor or treatment of choice. Melanin.